All right, let's go ahead and get started. Thank you for joining us. This is one of the Ask the Expert webinar series that Nephew has been doing. Tonight we're going to talk about navigating common insurance headaches. And I know that this is a topic that is relevant to a lot of us. So just to do a little overview on Nephew, I know a lot of you are familiar with us already. We are a nonprofit organization focusing on nephrotic syndrome and the diseases that cause it. We try to engage the broadest community of people with these diseases, so that includes patients, clinicians, scientists, biopharmaceutical industry, basically everybody who is involved in trying to find better treatments for these diseases. And we're looking to leverage support, raise funding, and basically get those treatments on the shelf faster to you all. Here's just a brief slide about the other Ask the Expert webinars that we're going to be doing in the fall. At the bottom there, you can see traveling while taking immunosuppressants, the unique adult experience. These are some of the ones that we've done already this year, and the recordings are all available on our website. After the webinar, I can send that out to everybody. So definitely other topics of interest, and we're always willing to add more. So if there's a topic that you don't see here that you'd like us to discuss, just shoot me an email and we can add it to the list. We are joined tonight by Brandon Helm, who's a patient dad, and he is the designated insurance wrangler in his family, as well as Christy Scott, who is a patient grandmother, but she also has over 20 years of experience dealing with health insurance from all different sides. She's worked for Medicare, Medicaid, doing claims processing. She was an investigator for the state of Nevada in their Division of Insurance and Enforcement. And she really enjoys helping consumers get reimbursed and get the coverage that they should be. So with that, Brandon, Christy, I took you off mute. Go ahead and say hi.
Hello.
Hello. Brandon and I just met right before the call, so we're going to kind of toss the football back and forth, but since he's a wrangler, I don't know, maybe if we should use some kind of cowboy metaphor. What do you think, Brandon?
I have my boots on.
Perfect.
Well, we're going to need it dealing with insurance.
So as you all can see, you can ask questions, and I will go ahead and ask them throughout the presentation as they occur to you, and I will make sure that the speakers get those. Brandon, can you just take real briefly a second and let people know Macy's story, just because I think it illustrates that you've really been through pretty much everything.
Yeah, so many of you may know my wife, Kelly, who's also on staff with NetCure and kind of famous in the kidney world, if you will, as being a real solid resource to patient families, especially pediatric patient families, and especially those who are new to the diagnosis of FSGS or nephrotic syndrome. My daughter Macy has been featured in a number of publications and videos that we've posted and whatnot, so you may have seen her story along the way somewhere as well. Macy's turned 10 this year, earlier in January, and was diagnosed at the age of 3.5 with nephrotic syndrome that eventually became FSGS. At the end of June, we will celebrate 5 years from the date that she received her kidney transplant, and then she became a reoccurrence patient the night that her transplant was completed, and so we spent 34 days in Lurie Children's Hospital in downtown Chicago with a whole bunch of complications resulting from that. So we've been through oh gosh, we've been through it all. The Cellcept and the rituximab and all of the chemo drugs, and you know, keeping her inside from blood counts being too low, et cetera, and then through the transplant process as well. So.
And with that, I think we can go ahead and get started.
Great. We can go
So
to
first of, yeah, got it?
You're good.
Okay. We know that this topic is really important to patients in general, specifically, with nephrotic syndrome diseases. You've got some extra challenges. They're difficult to code in the insurance system, and I'm sure that Christy can talk more about this, but that pulls everything down and makes it really confusing for people on our side and especially on the payer side. Most treatment options are off-label, well, a lot of them, and are sometimes unfamiliar for insurance companies. So what we want you to get out of this is that you're the best advocate for yourself and for your family in these cases. Christy, do you want to go ahead with this one?
Okay, and yes, it is a difficult process, and to really quick on the whole coding thing, if you can realize that most of the people that are processing the claims are humans sitting and doing data entry, or in most cases, your claim is just going through electronically. So once the physician billers code that claim and it goes to the insurance carrier, that's how your child or your bills are being identified to the carrier. So if there's a digit off or not all of the information is in there, their system is trained just to kick that thing back out and deny it. Generally, people will just say, oh gosh, my insurance doesn't cover this, and pay the bill. My recommendation is always, always, always question everything. When they deny something, make them tell you why. And this is, it's very important that, and I'm sure Brandon can speak to this too, that you be your own advocate. Don't just accept what they say. Call them up, ask them why they coded it that way, and really push to get your answers. It's your insurance and your money that you're putting out. We all know that with this disease, you have many more doctor visits, you have emergency room trips, you have specialists that a lot of claims examiners are not used to dealing with, you have second opinions, you have a whole plethora of things that the carrier is shaking their head at, going, well, we don't really understand this, and they're going to try to put it into a box so that they can either pay or deny your claim. You all know that you probably have been outside your network more often than not, especially if you're doing a thing such as my granddaughter does, going to Stanford, which is, obviously not in Nevada where I'm from. So it's you're dealing with just this huge gamut of things that the insurance carrier is not used to seeing. They want to see the bills for just an office visit, just a straight emergency room stay, whatever. So again, you've got to be your own best advocate. Brandon, would you talk a little bit about that third area there, the off-label therapies and the step therapies? Because you've probably got more experience with that than I do.
Yeah, I think, when I was emailing with you all earlier, Abby, I mentioned that I think your second best advocate other than yourself is going to be your physician. And the relationship that you have with them and the folks that they've got at their office to help you manage that insurance approval process is really going to help you in trying to minimize that stress level as you work through getting those different regimens approved. And those off-label drugs that are approved by the FDA for some other treatment protocol, and not necessarily as a primary treatment protocol for nephrotic syndrome, it is where you'll get real experience real quick in trying to get those approvals through. And that doctor's ability to sell the insurance company, if you will, because it kind of becomes a sales job in convincing them that this is medically necessary, that the research or that the success rates are good enough in this situation or that situation to warrant this being a viable option for this patient. And so your doctor, their medical staff, your social worker, our social worker has saved us, has probably saved us hundreds of thousands of dollars. I always tell our social worker that if we would not have the resources that she's found for us, we probably would have filed bankruptcy and or been in the process of losing our home. It has just been that big a deal. The programs that she's found us and the opportunities for secondary coverage through Medicaid has really, really helped us continue staying afloat and being able to concentrate on care of our daughter.
Okay, great, thank you. I'm going to move on to the next one. This is just an overview of helpful terms. Christy, any in particular we want to touch on?
Absolutely. The network versus non-network is really super important. If you do not have a network physician, that doesn't shut the door for you. If your network primary care doctor refers you out to somebody and they are non-network, as an example, my daughter had a serious issue with her pregnancy, and this is not related to nephrotic syndrome, but what had happened is she has a heart condition, she had a pregnancy, her primary care doctor referred her out to an endocrinologist. She started going to the endocrinologist and receiving B12 injections. Both the endocrinologist and the B12 injections were denied by her insurance because this doctor was not a network physician. So we went back and we did an appeal letter, and I think Abby will have a copy of kind of a sample that I took off of that situation. I redacted her information, but in a nutshell, we were able to get all of that treatment covered because the insurance carrier recognized that the primary care physician is that gatekeeper. And as Brandon said, they are one of your best advocates. But they can also, if they refer you to somebody that's incorrect, you know, again, somebody might have just said, oh gosh, I've got to pay this out of my pocket. No, you don't. You have appeal rights, and if you can articulate clearly, this is what happened, this is what your policy says, and this is what, you know, is a result of this. What happened in her case is they reversed the decision. They paid for all of her treatment. They paid for all of her injections because they were, if you'll see on the slide, accompanied by a letter of medical necessity for her pregnancy with the heart condition. That information, once in the carrier's hand, they reviewed it and they said, you know what, you're absolutely right, and they paid the claims. So the network versus non-network can be a real sticky area. Another area that you need to understand on that, and I'll just touch on this real briefly because I know we're short on time, is if your child or you are hospitalized, once you walk in the door of that hospital, if it's a network facility, they have now taken your choice away from you. So the insurance carrier cannot say or cannot deny any physician that they call in as non-network. Because in essence, you can't call and say, okay, gosh, is this consultant that's coming in to see my child a panel physician? The hospital is responsible for that now. So if you ever get a denial when your child has been hospitalized, you just go back to them and say, no, the hospital called this physician in, I didn't do it. And that's kind of important on that. I've seen a lot of people get really stuck on that. Some of these other terms, the step therapy, I've known it as something different, but it is the practice of going through several different medications first to get to the one that, in a nutshell, is the most expensive treatment option. Some insurance companies want to see that you've tried these other options, and that's not always, it's not always something that you can do, that you have the luxury to do. Again, go back to your doctor, best advocate for you, have him articulate in a letter, this is why they need this medication. A dispensing limit, it's kind of self-explanatory. It's a limit on the drug that can be given at a specific time. A drug formulary, we all know Big Pharma, the insurance companies are, you know, in cahoots with the pharmacies, and they want you to use specific drugs. So they will have a formulary that tells you what drugs they want you to use. When you have nephrotic syndrome, you all know, my granddaughter's been through the rituximab and the Celcept and has been on the steroids since her 2nd birthday. She'll be 10 this year as well. And we know that there are some drugs that we're not going to put our kids through that with, or our grandkids. So again, getting that letter of medical necessity and articulating that this is why this drug is important is a good practice. Again, be your own best advocate. Prior authorization. I know that my daughter has dealt with this. She's had to get prior authorization for some of the drugs. Many times it's just a call. She'll change pharmacies, and then the pharmacy will immediately deny the claim again, and she'll have to go back and say, no, this has already been approved. So a lot of times it's just a quick call to the insurance company to remind them that, no, you've approved this before, and you already have that prior authorization. Off-label, it's a drug that's FDA approved to treat a condition other than the one your doctor's prescribing it for. An example would be, I know that they gave my daughter the B12 for her heart condition during that pregnancy. Normally it's used to treat pernicious anemia, but it is also used to treat some other pregnancy-related conditions. So, Brandon, did you have anything you wanted to add here?
Well, a couple of things. I learned the hard way a question that I will never ask again. And I use United Healthcare because that's our primary insurance, and it has been for a number of years. And overall, I have pretty decent things to say about them. But I learned the hard way in asking the question, do you take United Healthcare? Because it's not the best question to ask. Anybody in their right mind will take any insurance. It's whether they're in network or not, and that's really the question you should ask is, are you in network with United Healthcare? And, you know, provide them even as much as providing them an ID number and a group number so that they can, you know, do further research if there's question as to whether that's going to be covered as an in-network procedure or visit. The other thing I would say is don't be afraid to control the pace of care. And what I mean by that is that so many times you go to one specialist or you go to a primary care and they start referring you to other specialists faster than you can hardly keep up with the appointments. And sometimes you forget to check and ensure that the appointments you've set are with healthcare professionals that are in network and are going to be accepted by or going to be accepted by your insurance, and you're not going to have issues down the road. The worst time to figure out that you've got a problem is after the visit's been done, the procedure has been taken care of, or the bill has already hit your mailbox, and now you realize that you've got some questions you wish you would have asked earlier. So don't be afraid to slow things down and say, look, I need to go ensure that these insurance benefits are verified and that I'm okay to see this physician for this issue before we get too far into this, and make sure that you're comfortable with that before you let the pace get in front of you.
Great points. Just to tag on to that, I keep a small notebook in my purse with me at all times. Anytime you call your insurance company, date, time, who you spoke to, and what they told you. That will be one of your absolute best practices as you're going through this entire process. Because when you call them back later and they say, well, who did you talk to? And you're like, well, I don't remember. It's much more difficult for them to go pull those phone calls back up. Most insurance carriers record every phone call, and if you've got the date, time, and the person that you spoke with, and they've told you that this is an in-network provider, they can go back and check into that, see that you did speak to them, that you were told it was in-network, and that covers you for that kind of issue. I think we can go to the next slide. Okay. This is a really good one. A lot of times we change insurance, and when you're looking, or if you're going through open enrollment at work, always check if you're going to consider changing insurance, or even like with my husband just now, we went through open enrollment for the state of Nevada. And one of the first things I do every year, even if we're keeping the same insurance, is I double check to see that my physicians are in network and my specialists are in network. And there's the other thing that you have to understand about in network and out of network. A lot of carriers have both HMO, which is a health maintenance organization, and a PPO, which is a preferred provider organization. And the biggest difference between the two is with an HMO, you're generally just dealing with co-payments. With a PPO, you're many times dealing with a deductible and co-insurance and sometimes co-payments. Their preferred provider panels could be different between the HMO and the PPO. In my daughter's example, the endocrinologist was a PPO provider. However, my daughter was under the HMO plan. So it was a very sticky situation. Will you need referrals to specialists? We all know that's a given. Is your treatment option covered under the insurance? And are you required to do step therapy? Get to know your plan document. That's your best friend. And most insurance plans that you have will have two different things that you should really familiarize yourself with. One is the summary of benefits. And that's the short and sweet, I pay this for that. I pay $100 for an emergency room visit, or I pay $50 for urgent care. Then they also have what's called a plan document or a summary plan description. They call it by a lot of different names, but it's the FAT document that goes through and tells you everything that's excluded under their policy. When you're calling them and they're telling you something's excluded, tell them you want to know what page it's on. It's very important. They have to support their denials or their refusal of treatment. And that's going to be two very important documents for you. So go ahead and go to the next. Brandon, did you have anything on that?
I guess the only thing I would say with regard to the in-network and out-of-network and knowing your plan is if you're in the process of, or the term transplant has been used anytime recently, and you think you might be headed out of state for a transplant, find out what your coverage is out of state for your current healthcare plan. We were fortunate enough to have a nationally recognized healthcare company or health insurance company, but there are a lot of lesser, cheaper programs out there that are either state-run or state-specific, and once you get out of the state line, sometimes you're really in trouble. And for something as large as a transplant, making sure that you kind of plan ahead a little bit if you have options on who to choose as your provider is something that could help you out down the road.
Perfect. Good, very good point. Next slide. Okay, working with your doctor. This one I am going to give to Brandon, but I do want to throw out a disclaimer there first. I'm going to just really emphasize his comment on the social worker. In every state that I've been in, if you are within the Medicaid program, take advantage of that social worker. They have so many resources. It's not even funny. The other thing that you can ask for on if you don't have Medicaid, you just have an insurance, you can ask for a case manager. Many insurance carriers will allow you to have a specific claims examiner as well. I know that's not very well known, but I've seen it done in several insurance companies, especially if it's a high dollar claim like this. They want to manage the funds as much as you do. You want to manage the care, they want to manage what they're spending. But a case manager is something that is going to be important to both of you. So Brandon, if you want to take this one.
You know, medication can be one of the most frustrating pieces to trying to get insurance coverage straightened out. And part of that is because when you go in to get a prescription filled, especially a new one, for a while there, we held our breath and crossed our fingers that we would walk out of the grocery store with the prescription that we went in to get. And sometimes that was such a fear because you never knew what was going to get covered and what wasn't going to get covered. And until we really kind of got to know our pharmacist and until we got to know the plan a little better, I'll tell you, it was challenging. A few things with regard to medication. First of all, use the same pharmacy for as much as you absolutely can. Not only are they watching out for interactions between different drugs, but the better you can get to know your pharmacy staff, the better the easier your life generally will be. And if you aren't using a pharmacy where you feel like you're getting to know somebody, I really would encourage you to move along to somebody else who wants your business. We know every single person in our pharmacy by a first name. I was actually there about 3 hours ago, picking up a couple of things, and I know that Lucas is the manager of the entire pharmacy. I know Jolene, who helped me this afternoon. She knows me by first name when I call in and say, hey, Joe, it's Brandon. And she knows exactly what's happening. I can't tell you how many times they have either given us a few pills to get us through until the insurance gets it figured out with the prior authorization. They've given us a partial refill. They've expedited an order for a special drug that we needed that may not have been otherwise easy to get. They have called all over town and up and down the Front Range. I drove 45 miles up the interstate to a whole nother county to get a drug at one of their locations, only because they spent the time on the phone trying to find a pharmacy that had that drug. So the better you can get to know those pharmacy staff members, oh man, it really makes your life a lot easier. A lot of these companies are trying to force folks into going to mail order. Mail order works if you're on a maintenance drug, you've been on that drug for a long time, the dosage doesn't change, the frequency doesn't change, and you just simply need it to be on kind of autopilot and auto refill. With these kids and any patient that's dealing with drugs that are changing all the time, mail order is an absolute nightmare. And so anything you can do to get an exception to a requirement that you use mail order for specialty, a lot of times they say, well, you have to go to mail order because it's a specialty drug. Well, in my opinion, the specialty drug is actually a better reason for me not to use mail order, because a specialty drug generally means that I have a higher likelihood of that dosage having to change on a pretty consistent basis or without a whole lot of notice. The problem then becomes is that if I can't go down to a local pharmacy and get a refill because the dosage changed and now I'm out because I've been having to take 2 a day instead of 1 a day, now the insurance is confused and they can't get me the drug as soon as I need to start making as soon as I need to start taking the dosage that was prescribed. So I've been successful in getting mail order requirements reversed, and we currently do not get anything mail order, and all of Macy's drugs, with the exception of one compounded suspension that we cannot get at our pharmacy, is all at one location. And the other thing that I would add with regard to pharmacies, the one specialty pharmacy that we're using for the compound suspension, for $3 they will deliver it to our house. And I can't tell you how nice it is, because that specialty pharmacy is not on an end of town that I frequent ever. And so for me not to have to go down there for $3, it is well worth letting one of their delivery drivers come to our house every time we have it refilled. And it's dropped on the front porch. It's in an ice pack ready to go. It can sit there all afternoon and not be a problem, and has been a real big help to us getting that suspension every month. And the suspension is part of the reason she's on the suspension is because the dosage changes depending on what lab work looked like for the week. So that's another big help in knowing, you know, being prepared for being able to make changes to dosages on the fly.
So we've got a couple questions. Did you guys see these?
I can't see any questions.
I don't see them.
Okay. All right. I tried to send them to you, but Marlene is asking, our prescription plan does not cover the meds prescribed. They cover no specialty drugs at all. Any suggestions?
Absolutely. Absolutely. Marlene, does your child have, are they on Medicaid? Because if they're on Medicaid, again, I would go
No,
to
they're not.
Okay, if they don't cover it, again, here's where you want to go to the doctor, get a letter of medical necessity, because here's the thing from my Division of Insurance background. If the policy has an exclusion on specialty drugs, or if they're not covering specialty drugs and it's something that is required for that child, the insurance divisions of each state would never approve a plan that doesn't cover something like that, or let me say, I would question it if they would approve a plan that doesn't cover them. So there's a couple of options that you can do. Number one, get a letter from your physician and make sure that that letter articulates the medical necessity for that drug. Go to the insurance carrier and appeal that. But before you even do that, ask the carrier to give you a where in the policy it shows that they're excluded. Because if they're just telling you this over the phone or just denying it on an EOB, you want to make sure that they are being honest and that is accurate. A lot of them don't like them because they're more expensive. And they don't, they've got the benefits geared so that usually those specialty drugs are more expensive for you as well. But I would absolutely get something from your doctor. One of your other great advocates is the Division of Insurance. When you file a complaint with the Division of Insurance in any state, they immediately turn around. Their turnaround time is 1 to 2 days, but they give the insurance carrier a 10-day window to respond. Insurance carriers hate to get a complaint from the Division of Insurance because then it opens the door for the division to come in and look at all of their processes. So I would absolutely contact both of those. And Abby, if Marlene would like my contact information, please feel free to give it to her, and I'll see what I can do to help her offline.
Yeah, definitely. I think I'm so glad everyone's asking questions. We're going to get to some of those, so let's move on a little bit, and it seems like the appeals process is going to be really important for a lot of people. Yeah. Before we move on, Carol was just asking about what about a pharmacy chain like Walmart? I don't know.
Go ahead, Brandon.
We use King Soopers, which is a Kroger brand grocery store here, and that is where we've had the best experience. I would say a couple of things. First, go where you're familiar with and where you're comfortable. If the staff are not paying attention, you don't feel like the level of detail is there, the personal touch isn't there, move on somewhere else. If Walmart's where you get that and the insurance is easy to process there and you're comfortable with their staff and their hours, then go for it. I don't think that these drugs are drugs. I don't think where you get them is as big a deal as the service you're getting and the attention to detail and personal touch that they're given to make sure that you're getting the benefit that you're deserved through your health care plan.
Totally agree. My daughter has used Walgreens for 7 years, other than, like Brandon said, the specialty pharmacy that we had to use that did the compounding 45 minutes away for us. I wish they did the delivery. I'd pay the $3 too. But she's used Walgreens, and they know her very well, and they do the same thing that Brandon deals with. Again, I can't tag on to him hard enough that is such an important relationship.
The generic versus name brand, real quick, sometimes that really is a big deal. Macy is on one drug, and I can't remember which one it is, but her doctor absolutely will not let her be on the generic of that drug, and there's data to support that the generic just doesn't cut the mustard. So when you get a new prescription, make sure that you understand from your doctor whether or not they're okay with the generic of that drug. If they are, fine, no problem. Do generic when you can. It's obviously going to be much cheaper in most situations and is going to be just as effective. But every once in a while there's a situation where a specific doctor or specific doctor with drug combination doesn't work well, and the doctor is going to say, we've got to stick to the name brand on this drug. So.
Okay, great.
Right. Another thing to tag on to the prescription real quick, I'm sorry. A lot of you are dealing with kids, and it's really important that you're as well educated on those prescriptions as you can be. I know that my daughter has dealt with them giving my granddaughter adult-sized doses in error. They have given her pills that are too large for her, and they have refrigerated medication that was not supposed to be refrigerated. So make sure you're very educated between your doctor and the drugs. Read the data that every pharmacy, every prescription you get has an educational sheet. Read it. because, you know, nobody's going to look out for that patient like their parents. So just make sure you're educated on those drugs because they do make mistakes. Okay, I think we're good with the next slide.
So I think we've gone over a few of these, but can't hurt to do so again.
Mm-hmm.
Christy, do you want to take this?
Sure. I love this first one, remain calm. Yes, because what will happen is if you remain calm, they're going to remain calm. They're just people. They're not paid a whole lot of money, the ones that are answering the phone, and they're given a very short education. Claims examiners are not doctors. Many times the background they have might be some anatomy and some medical terminology. They're taught how to code, and they're not taught how to code, but they're taught what those codes mean. And a lot of times those claims are just electronically shoved through the system. So again, be firm but be gentle, and don't ever be afraid to question them. Ask for a supervisor. Ask them for evidence. Tell them that you need the page number in the policy to support their response. There used to be this exclusion called a wastebasket exclusion that carriers used to try to put. And at the very end of all their exclusions, it says, and anything else not listed. Well, I'm sorry, but you can't list everything in an insurance policy that you're not going to cover because things change all the time. So, you know, read your policy, educate yourself. I can't emphasize that enough. Sometimes in an appeal, like when you're calling an insurance carrier, it can be as simple as a little phone call. We had some things denied because they had coded the code one digit off, and it was for a male instead of a female. Well, their computer system recognized that my granddaughter's a female, saw that this code was for a male, and so of course kicked the claim out. A quick call to the carrier, oh yeah, you're right, that must be coded wrong. We'll reprocess this claim, and boom, you don't have to go through the whole entire appeals process. Sometimes it can just be a quick phone call, so don't be afraid to get on the phone and, again, be your best advocate. Brandon, you have anything you want to add to this part?
I'm good.
Okay. Next slide. Helpful
So we've
people.
talked a little bit about, yeah, the helpful people. Anybody we missed?
Well, we've got case managers, and those can be, you know, at your insurance carrier. Consumer health advocates. In Nevada, the governor's office here has a division that is called the Consumer Health Advocate Division. They may have them in other states. They're usually a different name in every state, but they're a unit that will go out and help you advocate with your insurance carrier if you're having problems. Your healthcare team. Brandon emphasized this as far as your physician. The office staff, the people that do the authorizations, those are the people you want to get to know. Drug manufacturers. A lot of times some of these drugs are so expensive, some of the drug manufacturers also have programs where you can get the drugs for reduced cost or for free. So, you know, those are other ones that you can deal with. Your state's Division of Insurance or Division of Managed Care. They both are tasked with ensuring that the insurance companies are doing their jobs. So they want to know when something is going south. So don't ever hesitate to use them. Even a quick call to them, they might give you some great information over the phone that you can then take back. But this is where your documentation is going to be super important. If you can go to the Division of Insurance and say, I talked to so-and-so on this date, this is what they told me, now they're denying it, you're going to be able to get that appeal resolved a lot quicker. So you have a lot of avenues to go. Then there's also the state's Office of Consumer Health. I think that's the same thing as the Consumer Health Advocate. And then social workers. Social workers are amazing. They've got all sorts of resources. Brandon, we probably should have put your pharmacist on here too. Brandon, do you have anything else to add?
Yeah, I have actually two other folks who aren't listed here. One is an employee of the benefits company that my company contracts with for our group of health insurance. So I have a local person that works in our benefits office of the company that we buy our health insurance through, who's our broker, if you will. and she actually has contacts that are not published to the rest of us to get answers from United Healthcare when we have trouble. So that is usually, Gail is the first person I call because she's local. I know I can just call downtown and I'm talking with someone here in town. The second person that I have is someone that Gail put me in touch with when I was working through a big issue that was super urgent with regard to mail order pharmacies. And she works for United Healthcare. And I'll tell you, if you find someone who gets the job done for you, ask them if you can have their information so that you can call them directly next time. Most of the time, if they've got their act together well enough to get you the right answers, they're willing to be a contact that you can directly get in touch with. So I call her when we can't figure it out through Gail. I rarely call the 800 number on the back of the card, and I'm not saying that you can't do that, but if you get into a situation far enough where you get someone who's doing the job, see if there's a way for you to contact them directly the next time there's an issue.
That's a great point. I do the same for my own insurance. I've had some health issues of my own, and I found that one person that you click with on the phone, and this is another reason to be calm when you're calling. You may find somebody on the other end of that phone, even though they work for the insurance company, they're people just like you and I that are just doing their jobs, and if you can connect with that person and say, hey, you know, I really need somebody that I can just talk to whenever I have an issue. This is such a complicated case. And ask them, can I have your number and just deal with that person? I do the same thing, Brandon. I never call the 800 number because I call my contact, Paula.
Yep.
That's a great point. One of the other references I have to helpful people, other parents. Nephcure.org and the Facebook page for Nephcure, there's a lot of other parents on there that might, have gone through the same thing that you've gone through. I know with this last walk that we went on in the Bay Area recently, we traveled over there, and it was such a blessing for my daughter because she's finally met other parents that are walking this walk with her. And my granddaughter's met other kids that have been through this. And, if we can be a resource for each other, I think that's just another great something that should be listed under helpful people. Okay,
all right, I'll add to the list. I think we've talked about most of these, other than this advocate piece, which I can touch on real quick. I do some of the advocacy work at Nephcure, and we're always writing letters to our congressional representatives. We're always going to the Hill and setting up visits and trying to make this easier for kidney patients. There's legislation that's proposed every year that would possibly make some of this stuff easier and simpler and get better coverage through Medicaid and Medicare. So, look out for those opportunities because it helps to make you feel like you could be making a difference and making this easier for everybody else as well.
Absolutely.
Anybody have anything to add?
No.
All righty. So rejections. Let's talk about that because I think that, this is something that if you're on this webinar, you've probably had to deal with.
Oh, yeah. Rejections. Depending upon your policy, there may be first, second, other levels of appeals, etc. Familiarize yourself with your insurance policy and what the process is. The first thing you should do, though, is just call. Call them up and say, what's going on? Give me an explanation. If they say, well, I don't really know, escalate the call. Ask to speak to a supervisor. Ask to speak to someone that does know. Any good customer service rep with an insurance company should be able to tell you in your policy what page, where it was denied, and why it was denied. So make them do their work. Make them give you that answer. And if you don't get the answer that you want, follow the appeal rights section and pay really good attention to the timelines. Every time you get a claim rejected, there should be on either the back of the explanation of benefits, the reason for the denial, and it should list what you need to do to appeal that. Every appeal that I have ever done, I do both via facsimile and regular mail, and that way they can't say that they didn't receive it. But make sure you know how they work for your specific policy. On the appeals, do we have more slides on the appeals, or should I just continue on this one? Okay, I see that one. Let me go a little bit further. On the appeals, there's 4 different areas that you really want to focus on. The first thing you want to do is address in your letter what the insurance carrier did. You denied my claim on this date for this reason. Then you want to go into what what your process was, depending upon what it was that was denied. In my daughter's case, I said, you guys denied her B12 and her physician, and this is what you said. Then we went in and said, okay, she went to her primary care physician, et cetera, et cetera. And then you want to go into their policy, and you want to quote the area that you feel supports your appeal. If it's that you were supposed to go to your primary care physician, you quote that area and you say, I did go to my primary care physician. Sometimes these letters can be long, but it's important to get all that information to them because you only have a certain number of level of appeals. You include any clinical data that supports it. If you have a letter from your physician, include that letter. Ask the doctor to be very specific about the medical necessity and not to just say this is medically necessary. Some of them will do that. That's not going to fly with the insurance carrier. He needs to say why it's medically necessary. It's going to do this or it's going to prevent that. But always use the terms that are in the plan. Document, present evidence or cost comparison that demonstrates what the requested service will say. It may help sometimes, but it may not. And the reason that I say that is because the insurance carriers are very cautious about doing what they call setting a precedent. In other words, if they bend the rules for one, then they're going to have to bend them for somebody else. That's not necessarily true. If you can articulate this in your appeal letter, then it gives the insurance company support to say, well, this is why we did that. Because we had all this information, we had all this data. Always keep a copy of the letter, date it. But you can request a return receipt, but coming from an insurance carrier standpoint, we were trained to say the return receipt only shows that we got your envelope, not what was in it. And that's why I do, and that sounds really snarky, but that's what they rely upon, and that's why I dislike them. That's why I always fax and mail. Every insurance carrier should have a fax number that you can send it to. And then you've got your fax confirmation that shows the number of pages, and you've got the fact that you mailed, you've got your copy of your letter. And I always put on my letter, sent via facsimile and U.S. mail or priority mail or whatever. You can use a tracking number as well if you want to do that. You can have your doctor review the letter and ask them what they think. Some of the doctors will charge to do that, but if you've got a good relationship with them, most of the time they won't. And they won't because they want their money too. Pay very strict attention to the timeline for appealing because that's the first thing the carrier looks at. They look at it to see did they appeal it within the 30 days or the 60 days or the 90 days. My policy right now is a year, so I have plenty of time to do those things. And another thing to know about their denials, there is a terminology in insurance. It is bad faith. It is considered bad faith for an insurance carrier not to deny your claim for every possible reason that they can at once. In other words, they can't say, okay, I'm going to deny Dr. Smith because he's not in the network. Send you that letter. You go back and you appeal it and you show that he is in the network. Then they go back and they say, well, but his services aren't covered under the plan. They have to do that all at one fell swoop in the very beginning. They cannot, drag this thing out and, send you 18 different appeal letters for the 18 reasons they want to deny your claim. They have to do it all at once, or they're doing what's called bad faith. And insurance carriers don't like those two words because that's when the Division of Insurance gets involved and starts fining them. I think I'm kind of checking off some of the things that I've talked about. I'm going to hand it over to Brandon now because I know he's got a lot of stuff to say about this too.
I just would say don't be afraid if you find yourself in a situation where you're having to get into an appeal. Don't let the appeals process be as intimidating as sometimes it's easy to let happen.
Mm-hmm.
You're just questioning somebody who processed something or a computer who processed something, and you're finally forcing them to put a human in front of your case and intelligently look through the data to decide whether or not this should be allowed or not. I always go straight to my social worker anytime I decide it's time to go with an appeal process. If I let her know what I'm appealing, then she does the legwork for me and goes to the nephrologist, gets the letter, either writes the letter, or sometimes I even send her the details of what I feel like the letter needs to say. She sits down with the doctor, they figure out how to get it done, she gets it signed, emails me back a copy, and then I've got that to attach to the letter that I write. Always write your own letter too. I think it really makes a difference if you've got your perspective in addition to the medical perspective. The more people they can see you incorporated into working on getting this appeal to them, I think the better leg you have to stand on when it comes to somebody sitting down and reviewing the appeal that you sent in. I've been successful with my appeals, so I don't have the horrific stories. It's just that it's a lot of work, and just make the time to get everything done that you need before you send it in. Sometimes you get distracted and you forget the pieces that you wished you'd put in later on, and as you do these a few times, you get better and better at doing them. I got a bill this week, just kind of an anecdotal story here. Macy was at kidney camp in the mountains last summer, and the nephrologist felt like she needed, because it was a Sunday afternoon, we were headed back from vacation territory back down to the Denver area. The traffic gets backed up and sometimes can delay 2 or 3 hours getting out of the mountains. And her nephrologist felt like they needed to call a local ambulance service to allow her to get back to town sooner, so that she could get admitted and get treated for the infection that was brewing. And so I followed for a little bit until they got to the bad traffic, and they did red lights and sirens, took the shoulder, and made it back to Denver about 2.5 hours before I did. The ambulance service bill was $5,500. I got a call, that was last summer, okay? I talked to them about 30 days ago, not knowing that this still had never been taken care of. I didn't get a bill from them. They've been dealing with insurance on this. And so her comment to me was, well, insurance denied it because this was not considered an emergent transport. And I said, well, I'm not sure why they didn't consider it an emergent transport. They went red lights and sirens most of the way down to Denver. And she said, they did? And I said, yes, because I watched them, and they got to town several hours before I did. And she said, well, you know what? My ambulance driver didn't note that, which isn't necessarily wrong, but it's helpful that you told me that because now I can code this as an emergent transport, And I've never seen an insurance company deny an ambulance transport that was considered urgent that was done with red lights and sirens. I said, okay, great, go for it.
Yeah.
Well, just last week I got another bill from them for the same $5,500. So now I have to make a call back to the provider and find out, did you rebill this under your new your new code of urgent transport, and did United not respond? What's going on here? With the Medicaid secondary, usually we don't even see those bills because they're paid by the first and secondary insurance before we even catch wind of what the total on the bill was. So just kind of an example, real life, of the runaround you feel like you get sometimes, but if you don't follow up, no one else will follow up for you. And sometimes if you care about your credit, you kind of need to make sure that you've got your head in that game, even though it's not always fun.
Well, and let me tag on to that because you bring up a really good point. If that bill is now beyond the carrier's window of timely filing of that claim, that may be why it's denied. And if that is the case, the ambulance company has to eat it because it was their mistake. So that's another thing to look out for. If they don't bill you and don't bill you, because I see this all the time with my granddaughter, we'll get a notice like a year later. And they'll say, well, the insurance carrier denied it as beyond their timely filing requirements. And I said, well, that's your problem then. You are a contracted physician with them, and that's your job to get that claim in timely. It's not mine. So in that situation, if that's why it's denied, they have to eat it. That's part of their contract.
Yeah, I don't think that's the situation here, but I have run into the untimely filing issue with in a Medicaid issue where they billed at primary and they got paid, and they didn't ever properly bill Medicaid. Mm-hmm. And I finally got a hold of someone at Medicaid, and they said, they've got a problem because we're not going to pay them, and according to state statute, you don't have to pay them either. And at Medicaid actually sent me a letter. They said, look, we're going to mail you a letter, and we're mailing you 2 copies. One of them you keep, and one of them you send to this biller, and you tell them you do not want to hear from them again because here's the state statute that tells them that they may not contact you about this bill again because this is not your problem. So
that's correct.
Sometimes you've got to get firm with these folks, and I never heard from them again, and it was taken care of, but it wasn't because I didn't have to put a lot of effort into getting to that point. So
exactly, and that's another Medicaid thing. They cannot bill. Medicaid providers have agreed to accept the payment as payment in full, so they can't balance bill you, and they cannot bill you for something that is their error if they didn't bill it timely.
So I hate to say this because there's a lot of great discussion going on. It is 9 o'clock. Can we try to cover Medicaid and Medicare in just a couple minutes, because I think there's some really important points in here.
Yes. I don't deal with Medicare as much, but with kidney disease, there is a lot of Medicare crossover. You've got different parts of Medicare that, again, just educate yourself on this. Talk to your social workers. You can also go to their website, which is cms.org. They have tons of information and help on their website for Medicare. Medicaid eligibility, just by virtue of the fact of this disease, it doesn't matter what your income levels are. There are usually waivers in every state for Medicaid coverage of your child's medical expenses. And in some states, they have a waiver now that also, let's say you've lost your insurance. Some of the states have done this waiver where they will actually pay your COBRA premium for you rather than pay the expensive claims. So you can look into that as well through your social worker.
2 things very quickly. Yes, the waivers exist, and don't pay attention to what they're called. I say that for this reason. The waiver Macy's currently on, which is called, now it's called something like the Hope waiver or something. Mm-hmm. It was called the hospice waiver when we started this. Well, this had nothing to do with her being anywhere near a stage of being in hospice, but they called it the hospice waiver. If our social worker hadn't found it for us and educated herself as to what the waiver was all about, we'd still never know about it. The waivers really saved our life as far as taking care of all the co-pays and the deductibles that we would have had to come up with money for out of pocket. The other thing that you mentioned, here in Colorado, we just got approved within the last 60 days for what's called the Colorado Health Insurance Buy-In Program. The Colorado HIBI is what the program is called. What that does is it says, oh, you have private insurance? Well, we'll actually pay the premium that you're currently paying through your payroll deduction for that person, because it's cheaper for us to pay your premium than it would be than if you were to go on straight Medicaid, or Medicaid.
Yes.
So we actually started getting reimbursed recently for part of the premium that we pay every month for private health insurance as our primary coverage. So the state's helping us not only with the reimbursement for part of that, but they're also helping us with the waiver that she's on, and those two combined are real helpful to us. My employer pays $500 for my family's coverage, and the rest of that balance of my payment every month is $1,400 total. So I have $700 out of my paycheck every pay period coming out just for health insurance because I work for a small company, so the rates are pretty unreasonable. So to get a reimbursement from the state for part of that $1,400 that I'm paying every month is a big plus.
Yes. They just started that in Nevada as well, so that's another one to look into.
All right, great. Well, I hate to cut us off. This has been very, very valuable, and we might have to follow up with you too with another webinar. Maybe we can just talk about Medicaid and Medicare next time. So,
do we have time for questions?
Does anybody, any attendees have any more questions? We've been asking throughout, and I will definitely send out contact information for Christy to everybody on the call. You can always get in touch with Nectar if you're listening to this as a recording, and we will get you connected and get you answers to any other issues that might come up. So it doesn't look like we have any more questions. And I just want to thank everybody for joining us tonight. And thanks to Brandon and Christy.
You're welcome. Thank you.
Thank you.
Have a great night, everyone.